I'm Judy Griffin with Aroma Health Texas, and we're going to start a little mini-series on essential oils for cancer care. I made blends for hospitals in the United States, North America, Western Europe for 45 years, and most of them were for cancer patients. I blend my petite fluorescences with essential oils in many cases, and there's all about which petite fluorescences go with which type of cancer in this book, The Healing Flowers. And for children and babies, I only used petite fluorescences, which are enfleurages of flowers. Okay. I was one of the first ones that said, you know, we have to go topical. It works better, it lasts longer, much better than inhalation. And finally, research 45 years later has proved that, and it helps to use these essential oil or essential oil blends. It can help them before cancer, it can help them during chemo or radiation. It can help them before and after surgeries. Remember, they also have, we're going to talk about two different things. Let me step back. We're going to talk about how they help in cancer care physically, but then emotionally, keep in mind that these flower essences and essential oils also work with helping the patients with fears and anxiety, depression, even anger. Well, sure, all those things come up. So, since chemotherapy causes detox through the skin, I use a different place for application, and that is in the ear. Now, all the acupuncture points are in the ear, so this is like an acupressure, but right under that crease in the inner ear, we don't want drops to go in the ear. This is just one drop on a finger or whatever, however you use it. Hooks up with 5 major nerve ganglia that goes to the brain. So we will possibly be able to use essential oil blends on the feet. You really have to ask the physician, but I'm telling you, in hospitals, you know, where chemo is taking place, and I started with Baylor in Dallas, and I was there over 20 years making blends for mostly cancer patients, and they started me with stem cell and bone marrow transplants. And I thought, well, you know, I thought we'd try something a little easier than that, because most of the people, especially at that time, didn't live long, and if they did, it was like a year. But the first 3 weeks were very important, because they take you to day 0, which you really don't have an immune system when they take out your bone marrow, for example, and soak it in chemotherapy and then put it back into the body. And they have some massive reactions to that. And I've talked to people, a few people at least, that have been in contact with over all these years that got well, and the one thing they remember is how much pleasure and how they looked forward to using the essential oil blends and having that little bit of scent and comfort. And some people said they felt more in control of their situation and not so helpless. I want you to make sure when you're choosing essential oils that they won't thin the blood, because, for example, ginger root was used a lot for nausea because it is good for nausea. The problem is it thins the blood. So you have to take all these things in consideration. No one's going to do that for you. And there's so many essential oils. There's other ones that could help with that. And actually the one we're going to talk about today, which is Roman Chamomile, it's one of the ones that help tremendously with nausea, as well as vomiting, and many symptoms of cancer were helped by that. Now, I'm not saying that essential oils cure cancer, because it's not even the subject, okay? We're just looking at cancer care. It's like with herbs. Some people will get well with something and then think everybody is going to get well using that same combination, but that's not necessarily the case. So we're going to just stay with cancer care and the complications of cancer, and really more people pass away from the complications of cancer than they do the actual cancer itself. So these essential oils can be very, very important to use. Essential oils contain monoterpenes, which increase oxygen to the limbic brain. They increase antibodies. They release endorphins and neurotransmitters. So they have antiviral and anti-tumor type of conditions. They have 10 carbons in each atom, and they have a citrusy or coniferous type of aroma. The other type of property that has to be in essential oils for it to be good for cancer care is sesquiterpenes. They are alcohols, and I've mentioned before that essential oils are basically alcohols, and these have 15 carbons in each molecule, and they're very anti-inflammatory and antibacterial, so they make a good combination. And examples of sesquiterpenes would be lavender and frankincense. We'll talk about them at another time in our series. I'd like to just take one essential oil at a time and really concentrate on it. So Roman chamomile is proven useful for breast, colorectal, and GI cancer conditions, okay? It's an anti-tumor, and it's especially good for the triple negative breast cancers. Those have been very hard to treat, and they're very resistant to chemotherapy. Roman chamomile reduces the prolific nature of cancer cells. They can't grow as easily, and they reduce the metastasis because Roman chamomile contains a property called Apigenin, and this actually reduces tumors by keeping them from proliferating and from signaling. One could be started in the breast and then go to the liver. How does the cancer get there? They signal. It signals. They can signal to cells and then start a metastasis and more cancer in another area. Specifically, chamomile reduces nausea and vomiting and a lot of the GI symptoms, and they worked well on mouth ulcers. I did not do any internal stuff, we just did external, and we still had very, very good results with lessening of symptoms. Now, there's another side to this. Most chamomile contains distilled versions of Artemisia. Artemisias contain thujone. It is a poison. It damages the central nervous system. So, I want you to be very careful of the nature or the origin of where you get your essential oils, and I can tell you for sure from distilling it, you don't get very much, so it's expensive. It's expensive, not as expensive as tuberose or something like that maybe, but it's more expensive when you see it for a really lesser price, and some of the stores and places that you see it, it's been cut. Most essential oils contain 5% of the actual essential oil, and the rest is adulteration. So, we want to use also 1% or less of citrals with specifically hormonal breast cancers, and that information is available from Robert Tisserin's book, Essential Oil Safety. Now, I'm not selling this, I'm not trying to promote it, but I tell you what, it's got all good information, and the man is exactly who we want for that kind of information for the safety uses of essential oils. So you can see that there's even though chamomile is good for many types of breast cancer and GI and such, if we have citrals in the blend, and citrals are particular essential oils like lemongrass, lemon verbena, lemon myrtle, and melissa, which is lemon balm, then we really need to use 1% or less in our blend. Okay, we have our carrier oil in here, we have, let's say, our Roman chamomile in here, and then we're going to put maybe a top note or something just to bring it out. Well, a lemony smell is great, but just only use 1 or 2 drops. And consider using something like in one of the oranges, because they don't have the high levels of citral. If you're not dealing with estrogen promoted breast cancer, then it's not a problem at all. But in a 1 ounce bottle with our carrier oil, I only would use 5 or 6 drops of Roman chamomile. I keep saying Roman chamomile because there's 2 types of chamomile, one's German and one's Roman. And it's the Roman one that makes the essential oil we're talking about. It's very odorous, it has a nice aroma, but it's very strong, and I just don't think you need a lot of it, in a bottle like this. But try 5 or 6 drops and let it sit a day or 2 or 3, and then see if you need to add more. It's not the high odor or the high amount of essential oils that always makes it work well. It's the fact that, especially topically, they hit the circulation system and they move quickly through it. Remember, essential oils leave your body within 2 hours. So they're fast and they're volatile and they're deadly to cancer cells. Roman chamomile has 14% of ketones in it. We haven't talked a lot about these chemical properties of essential oils, and I'm going to bring little bits out during our lecture series on essential oils for cancer, so you will understand why you need to know a lot about them before you just start mixing. Ketones can be neurotoxic over a long period of time, or if you use high amounts in the blend. Now, 14% isn't terrible, but it's still up there, and so I would use lower amounts, 5, 6 drops, 10 drops, instead of 20 or 30 of your Roman chamomile. And you can mix other things in there, like a sweet orange or something, if you so choose, just to help bring out the flavor of this aroma. Because a lot with patients, it was the aroma they were really, so many of them really enjoyed. But it's not the kind of thing in a hospital that you want a whole room to smell like it. And when there were research projects done where they used inhalation it was only direct inhalation that helped with cancer care with essential oils. In other words, diffusing it in the room did absolutely nothing. So you either inhale it right to your nose, and there was like between 10 and 20 minutes necessary for that to be able to work, or you find a place on the body that you can use it topically, and you'll get very good results. I don't like to use Roman chamomile with children under 10. And the reason is because it is very, very strong. And there's other, you'll see, there's other essential oils we can use that'll be healthier for children. And I think that's all we really need to go over today. I hope you send me your questions. I hope you understand that I'm going to go through one essential oil at a time, but we may end up, or you may end up actually blending it with other essential oils. And for certain types of cancers, we'll find out which ones work the best for. And again, we're talking about cancer care, and we're going to make a huge difference with the stem cell and bone marrow transplant patients, which most didn't live more than 3 weeks. We went from 15% or less to 19% in a very short time, as soon as I started using the essential oils with them. The people who agreed to do that, you didn't have to, but most people loved it. And so it will make a difference. You don't have to worry about healing everything. You start with what you can work with, and this is what we can work with chamomile. And with the types of cancers, again, are breast, colorectal, GI, and those are the cancers we would be working with, okay? It can help these people post-cancer because some people get cancer return to their body. So using these essential oils, especially in that case in lower amounts, because we can use it long-term that way, then we'll give them better quality of life. I want to thank you for coming and being my teachers, and I look forward to your questions and concerns, and we'll see you next week. Bye-bye.